Okay, well, we will go ahead and get started here. Thank you guys for joining me this morning. My name is Jennifer Zodi, and I am the director of our Patient Services Division here at Mountain Pacific. And so today we are going to be talking about the prior authorization process that is transitioning to Mountain Pacific for eyeglasses and contacts. So hopefully you are a provider for eyeglasses and contacts. This training we have set up for about an hour and a half. There is a lot of information, and a lot of it is just trying to run through the system and what that looks like. And then I try to have enough time to do a quick demo to show that it takes way longer to explain it than it does to actually use it. So we'll just go ahead and get started here. Like I said, feel free to use the chat feature for questions. Make sure that you are muted. And then at the end, if you'd like to unmute and ask questions, we will definitely do that as well. All right, so our agenda today is I'm gonna explain what the Qualitrac system is, how to submit a request for eyeglasses or contacts, and then how you can view that request status and the outcome. So what is Qualitrac? So Qualitrac is a web-based health management system. This was designed and is maintained by a company called Telligin that we partner with. What's really great about the Qualitrac system is there is 24/7 provider access. It streamlines the review process, so all necessary information is in one location, on one page, no more faxing, things getting lost in fax land, those kinds of things. It allows for secure electronic upload of clinical documentation. So you're able to attach any medical records that you normally would have either possibly mailed or faxed, and they're right there and easy to access. It also, as I said, allows the provider to track the progress of the submitted request. So you don't have to call us and ask what the status is. You can go into the system and look and see for yourself. So beginning October 1st, well, technically the 2nd, because Monday is the 2nd, eyeglasses and contact providers will start to submit requests to Mountain Pacific through our Qualitrac portal instead of sending them to the department for review. So one thing that must be done prior to that is providers must complete the online registration process. So there's another training that is recorded and on our website, and I'll show that page on the next slide. But it is the May 2022 authorized official training. And so what that one does is it goes through who in your organization is going to be that authorized official, kind of the main one responsible for getting set up in the system. And then that person then gets anybody else set up. So if there's going to be more than one person at your office that's going to do this, which we highly recommend, so that it's not just one person. If that person's gone or that person leaves, that there are other people that can do that. So that would be the first step that you'll want to do when I show you the next slide, is to go find that May 2022 training. It's about 20, maybe 30 minutes long, or there is a slide deck that you can just go through and read the slides if you would prefer. It's pretty simple, very straightforward. That'll then get you access into Qualitrac if you don't already have that. The big thing is that only codes that require prior auth per the eyeglass and the optometric fee schedule need to be submitted. So if there's no changes in that, if it's anything that did not require a prior auth before and currently does not require a prior auth, those do not come to us. And I see Katie, you raised your hand, so I'm going to let you jump in if I misstated something.
No, it might just be me, but your audio is a little funky and I'm finding it a little hard it's got that like robotic tone to it.
Oh, goodness. Okay.
It just started just like a couple minutes ago.
Okay, thank you for letting me know. Let me see. That usually only happens on Teams.
And it just went fine again.
Now it's okay.
As far as I hear.
Okay.
If you see me raise my hand again, it's going to be similar notice, but
okay, perfect. I appreciate it.
So definitely want you guys to be able to understand me. So as I was saying, you'll get signed up as an authorized official. Once registered, you'll receive a username and instructions on how to create a unique password and then how to set other people up within the system. So this is our portal page. And this will be posted on our website. So you'll be able to access this link. I will also post it in the chat before we stop the recording so that you can access that. But this is our portal homepage. And so this is the main page that you will want to bookmark so that you can get back to this page easily. And on this page, there's a lot of different things. The portal sign-in is here. The portal registration link is there. The document library, there's just some different like user guides and things like that that are out there. The education and training, that is the tab where you will find that May of 2022 training that we have already completed. So you'll want to go to that education and training tab to find the authorized official information. There's some FAQs and quick notes. That was stuff when we first transitioned into Qualitrac, which was back in 2019. So there's a lot of different things that date back to then. So we've been in it for a few years now and have slowly added new services into the portal. There's been little minor changes along the way, but overall it's pretty much the same. Provider news. Anytime the state posts a provider notice that is pertinent to the reviews that we complete, we will link that provider notice from the state's website to this provider news section. So just as another opportunity for providers to be able to find those. So sometimes we're a little behind on them, getting them posted to our page. So of course the state's website is always your #1 place to go, but we do also try to put them there as well, just for another option. Of course, the contact us page, if you have questions, our phone numbers are on there. And then the prior auth check tool that actually is no longer active, and we are in the process of taking that down just with some changes that have been occurring over at the department and things like that. So that piece is going to be coming off of there. Let me see if I can. I was going to try to copy that web page and get that put into the chat for you so I don't forget.
Yeah, I already did. You're good to go.
Awesome. Perfect. Thank you very much. We'll keep rolling then.
Okay.
Okay. So once you get the sign in and you click the sign in button that was at the top of this page here, you'll click that portal sign in button. It'll take you to the sign in page. Here is where you will use the username that you were assigned, the password that you established, and then you click the blue sign in button to access the system. If for some reason you forget your password and you need to reset it, down at the bottom is a reset password link. And so you can click on that and it will walk you through resetting your password. So you don't have to reach out to somebody or ask somebody else to change it for you. You can go through the process on your own. We strongly encourage you to not bookmark this page. A lot of times people will try to bookmark this page instead of our portal page that I just showed you. There's a lot of security around this login page, and so it does cause issues down the road when you try to log in. So you may be able to get in 1 or 2 times, but then you may start having issues. So we just strongly encourage that you don't bookmark this page. If you do need to reset your password and you click on that reset password link, this module will pop up. You'll enter in your username, not your email address, your username. And then what the system does is it finds the email address that is associated with your username and it sends you an email so that you can reset it. And there will be a link in that email that allows you to reset your password. Okay. So once you get in, and you're not having any password problems, this is the Qualitrac landing page. This is the main page where you will always start when you log in. There's 2 sides to this. We do not use the care management side. We only use the utilization management side. If you were to accidentally click on one of the care management buttons, it is set up so it automatically takes you into the utilization management side. So there's no worries of getting into the wrong space when you're in the system. So there's a lot of different navigation tools that are along the top kind of menu bar. So the Qualitrac logo icon, this one will take you back to that landing page that we just looked at. So if you're anywhere in the system and you're not quite sure and you're maybe lost and you're thinking, oh shoot, how did I get here? Where do I go from here? And you kind of want just a fresh start, just click the Qualitrac logo. It'll take you back to that main page and then you can kind of start fresh. The next one is the user way, the accessibility menu. The bell is a messages display. So if there's been any messages posted by the Qualitrac support team in the last 30 days, you can view them there. Normally, let's say maybe they're having to do some maintenance and the system is down. They typically do that in the evenings every couple of weeks. There would be a message that goes across the top of the page right when you log in, letting you know whatever the situation may be. So if you close that message, if you click the X and it goes away, you would still be able to see it in that messages icon if you were to go in there. But normally they'll display across the top of your screen so that you see them as soon as you log in. The magnifying glass is probably one of the main ones that you will be using. This is where you'll be able to search for either a specific case or a specific member. And then the next one that looks like 3 bars is the task queue. This is where you go to complete any assigned tasks, such as requests for information, which we'll talk about a little bit later in the training. And then the question mark is a knowledge center. So within Qualitrac, there's some user guides, frequently asked questions, tip sheets, different things like that. So if you're needing any of that, you can find it there. And then the last one that looks like a little person, this is where you can view and manage your profile. And so in here, once you're set up, you can change your phone number or your email address. The thing you cannot change is your username. So every username is unique to that person. So if we're setting up an account for Jane Doe, a lot of times the typical username is first initial, first name, and last name. So it would be J Doe. Well, maybe there's already a Jane Doe in the system under J Doe. So then you want to do Jane D. You could do J Doe 1, but nobody has the same username within the system. So if you go to enter in a username, the system will tell you if that username is already in use, and you'll have to pick something different. If somebody were to get, have a name change for whatever reason, and they want their username to be updated, you would have to actually deactivate that profile and create a new one for them. So just so you know, you won't be able to change usernames once they're established. Okay. So if you want to start a task, so this is back on that landing page, you can either start tasks or you can do a search. So the start task is, again, going to take you to the task queue. So same as those 3 lines that were on that menu bar. And then the search button is the same as the magnifying glass that we just saw on the last page. So just a couple different ways that you're able to get to wherever it is you want to be. So the first thing when you're coming into the Qualitrac system and you're wanting to enter a request on somebody, you want to find that member. And so then you'll go in and you'll click that, either the search button that's showing here, or you use the magnifying glass on the menu bar. And then that's going to start the process of finding the member. So there's 2 ways to find the member. You either need to know the member's member ID number, so their Medicaid ID number and their date of birth, or you need to know their first name, last name, and date of birth. And those are required fields. So and they can't be partial. So you have to know the complete, like, first name, last name. If you're searching by the member ID and the date of birth, you would simply enter both of those in, click the search button, and it must be a match to the member data that's already in our system. So we get a feed from the conduit, the fiscal mediary. We get a eligibility file from them Monday through Friday with any changes to member eligibility. So they have to be on that file in order for them to be in the system. Sometimes with the member ID, if it has the 2 zeros that lead, for whatever reason, sometimes if you put in the 2 zeros, it may not find a match for you. So if you just take the 2 zeros off, then it may work. So for whatever reason, sometimes you have to have the 2 zeros, sometimes you don't, and sometimes it doesn't matter. So it just depends. So if you know you have that ID number right, sometimes it's just those leading zeros that are maybe causing some problems with it. If you're searching by their name or the date of birth, again, it must match the data that's in our system. And so you want to make sure that for first names that you have whatever it is that they are signed up under Medicaid for. So for example, if their legal name is James, but they go by Jim or Jimmy, you would want to make sure you're putting James in there, not Jim or Jimmy. So it has to match that information. And the spelling needs to match as well. So if you've entered in the member information and they exist in the system, meaning they're on that eligibility file, then the search results will be listed here. You can click on any of those data fields. So you can see the member ID, last name, first name, date of birth, gender. So all of those are actually clickable links. So you can pick any one of those and just click on it, and they're all going to take you to the same place. And so you found the person, you clicked on their name, and now it's taken you to the member hub. And so this is where you would be able to see any other requests that your organization has submitted on this member. You can see the outcome of those reviews, or if there's nothing in there, then you would know that nothing has been entered. So before you start a case and enter a new request, you would want to look in this utilization management panel and just make sure that maybe somebody else at the organization hasn't already submitted it, and that it's either pending or there's already been an outcome rendered. So you want to double check that so that there is no duplication. Okay. So when you click on that person, you can see their member detail information. And so if I go back one slide here, it's this top part, this top section right here. And so if you click this view member details, it's going to expand, and then you can see additional information. And again, this is based off of the eligibility file. So if there is no phone number on the eligibility file, there won't be a phone number that shows up here.
Hey, Jen.
Yes.
Your audio is going funky again.
Oh, goodness gracious. Let me try one thing. Switch to headsets, see if that does anything.
Okay, you're good to go.
See, I haven't even switched it over yet.
Hey, Jennifer, sorry. Is there any way for you to maybe call in via the phone audio to present that way?
1 second here. Yep, I'm trying to switch it over.
Thank you all for your patience. Well, technology is sometimes beautiful and sometimes not so much.
Very much so.
So
all right. Is that any better?
Yes, ma'am.
Okay, let's try this. I've got a headset on now, so we'll see if that works. Okay, so at the bottom of this screen, if you want to view even more member details, like their eligibility information, then you can click down at the bottom. That will expand, and then you can see more of the information. When you're done, you click that View Member Detail button over on the right-hand side again, and it will minimize. Okay, so we are at the point where we have the right person, we've checked everything out, they've got eligibility and we're ready to get a request submitted. There hasn't been one submitted for this person yet. So in the utilization management panel on the right-hand side, we're going to click the add button to get started. And we're going to add a new request. So what you'll see about Qualitrac is we refer to these as panels. And so each section is a panel. And the first panel is this authorization request. So this first section here, your date received is going to auto default. And then the review type, you will want to select Health Resource Division. Once you select that, the place of service is going to auto-populate and say other place of service. And then under the type of service, you will want to select either eyeglasses or contact lenses, whichever one you are requesting. The timing is going to be prospective. And then once that is filled in, you're going to hit the green Add New Request button. If for some reason at this point you realize, oops, I've got the wrong person, you can hit cancel and go back. This will take just a second once you hit the Add New Request button because it is now formulating the rest of the panels based on what you selected here and what information is needed. So when the rest of the panels then show up, there will be a dates of service panel. So your start date is the date of the request, end date, expected end date of treatment. So if someone is going to be getting, their glasses or their contacts and you're not really sure exactly when that's going to be, if you put in, you could put in like a month span or whatever, if they're going to be in there during that time period, we want to make sure that whatever date span we approve, that you're not having to call us back and say, oh, shoot, we missed the date, we need it extended, we need it updated. So we're going to give you a span there so that it's hopefully easier for you guys. So if you put in, start date is typically the date of the request. And then if you want to just go a month out, 2 months out, whatever you're thinking is the time frame going to be there. The next panel is the coverage panel. And so in the coverage panel, this is where information from the eligibility file pulls in. If they have Medicare, that'll be indicated. If they've got a third-party liability, there is also the EPSTED indicator that'll be in there. So if you are submitting a request that falls under the EPSTED program, it defaults to no. So you would want to just check that box to say yes if it is one of those requests. If there's a message that pops up on the coverage panel that says member not eligible, there is an eligibility comment box that you need to put a note in, which will then allow you to continue with the review. So the system tries to be very smart, and sometimes it doesn't, it's not. So if it sees that somebody has Medicare, it may think, oh, well, this person has Medicare, so then they shouldn't need to submit this under Medicaid. And so it'll say the member may not be eligible. You would just go into that eligibility comment. You can just put a simple has current Medicaid. You can put a note in there. If you don't put a note, it won't let you move past it. So you have to put a note in there and then it'll let you move on. The next panel is the personal representative panel. That one's not needed for this request, so you can just leave it blank and move past it. The provider panel. So here is where we're going to be adding who is the provider that is providing this service. And this is going to be then part of the request that is transmitted into the claims system so that the billing can happen appropriately. So on the provider panel, there will be an add button that you will click on. And when you do that, it expands this screen here to allow you to put in additional information and search for that specific provider. So a helpful hint here is that if you use the NPI number or your Montana Medicaid provider ID number, it's going to render the quickest results. And on this page, we have found that less is more. For whatever reason, if you enter in your NPI and the name of the organization and the city and the state, sometimes it overloads the system and it just doesn't know what to do. And it says there's no results found. So what I have found over the years is that if you know your NPI number, just enter that and hit search. And if you don't know the NPI number, then of course you can put in your organization name. You just may get multiple options because it's going to look for anything that potentially matches that. Okay. So once you put in the NPI number and it pulls up the results, there'll be a green plus button on the left-hand side that you can go ahead and click. And what that is going to do is it's going to add that to that provider panel section. And so if you get in here and you search by the NPI number and you have multiple options, then what you want to make sure you're doing is looking at this primary number. This is your Medicaid provider ID number, and you want to make sure that you are picking the one that is active. Unfortunately, we also have the inactive ones that are on those files. We don't have a way to kind of weed those out. So you want to make sure that you're picking the one that is current and active. If you put in your NPI and only one shows up, great. You click the green plus button and add it to your request. So under the provider panel, there's two providers. So there's your treating provider and there's your ordering provider. Your treating provider is going to be the one that is billing for the service. So this is the one that is going to be transmitted into the claim system so that when you bill, those numbers match up. So a lot of times what we see is the treating provider is maybe a group NPI number. So you're billing under that group, but then your ordering provider is going to be that specific individual provider of who actually is ordering the item. So sometimes we see where not everybody has a group NPI number or like the business NPI number. It may just be, that they're an individual and that's the only one they use. In that case, your treating provider and your ordering provider would match and it would be the same one. And you can see on here that after you add the treating provider and you go to add the ordering provider, if it is the same one, you'll just click copy and it'll copy that information forward. If you do need to add a new one, then you would click add new, go through the same steps we just went through, and then it would attach the next one that you put on there. So now you would have the treating provider and the ordering provider listed on here. Again, that treating provider is the organization who's actually billing. The ordering provider is the individual. If you made an error and you realize you need to change something, under the action column, you will have the delete option. You can delete and then you'll have the add button return and you can kind of start over with that. The next panel is the provider organization visibility panel. So in this panel, you must select your organization so others can see the request. If you don't, then you would be the only one at your organization that could see it. So if you have 2 or 3 people that are set up that can enter requests into Qualitrac, but somebody does not select the provider organization visibility drop down, then only that person that submitted it can see it. So it's very important that you pick that. However, there is a caveat to that. So again, if there is somebody who only has an individual NPI and they are not set up in Qualitrac with, and I have a typo, sorry. If they are set up in Qualitrac, oh, that's right. Let's try this again. If a person only has an individual NPI and is set up in Qualitrac without a group NPI number, then you won't have anything to select in this dropdown. This is something I just learned recently because after one of our other trainings with another area that we transitioned, we had quite a few calling saying, I don't have anything in the drop-down panel. And I'm like, but you should. So we reached out to Telegen, and that's when we found out that there are some people who are not attached to a group NPI number. So in those situations, you would not have the drop-down here because it's an individual. Okay, the next panel is the diagnosis panel. As you're seeing, there's this same kind of flow. You're going to have the add button on the right-hand side. This is where you're putting in the diagnosis information that's related to this review. Click the add button, a box will open up. You can either search by code, like the ICD-10 code, or you can search by the term. Either one works. The code, if you know it, is going to be much quicker. If you search by term, sometimes it's kind of finicky and you may search for something and it doesn't pull up, but yet you know it should be in there. And it's just because of the way it's worded. And so you might have to, type in some different terms to try to find it. So searching by code is going to be your quickest and easiest. And so then once you find the right code, if there's more than one, then there's a radio button there on the left-hand side. You'll click on that, which then selects it. And now if you want to add more than one diagnosis, you would say submit and add another. And basically it'll just kind of refresh it, let you go right back into searching and adding as many as you need. Once you've attached all the diagnoses that you need, then you would just hit the submit button, and then that one will take you back out kind of to the main page and allow you to move on. If there is more than one diagnosis entered, you have the ability to drag and drop them. I don't know that many people use this feature or that it's really that important. But if you listed, say, 3 diagnoses and you looked at them and went, well, wait a second, the third one really should be the main one, and I want that listed first, you would just click anywhere like on this line, click and hold, and you would just drag it up and then let go of the mouse button, and it'll move those in the order that you want them. Again, not that it's important to us in any way, but if for some reason you wanted to do that, that is available. You also have the trash can or the delete button. If you added a code and realized you added the wrong one and you needed to get rid of that and start over, you would click that trash can button. It'll remove it off of there, and then you can click the add button and start over. Next panel is going to be your procedure panel. Same thing. Here you're entering in that procedure code that you're requesting that PA for. So you'll click the add button, right-hand corner, and you'll go through the exact same steps that you just did for the diagnosis. If you search for the code, search for description, again, code is much easier. You can enter in as many procedures as you need. If you do need to add like a modifier or more than one unit, then once you select the code by clicking the radio button, then that modifier in the procedure detail panel will expand, and then you can add in there anything that you might need to add in. Again, as a reminder, please only include codes that require prior auth based on the state's fee schedules. And again, when this is posted on our portal page under the education and training, once these trainings are completed, you'll be able to access these slide decks, and then you'll be able to click on that link if you need them. All right, next panel is the documentation panel. So you must attach documentation in order to be able to submit the request for review. We have to have something to be able to look at. So just as in the paper process, when you were submitting them, any medical records to support the request you're going to want to send in. If it is an EPSTED review, then you want to make sure that you include the EPSTED prior authorization and certificate of medical necessity form. If you do have any questions around this, you can go back and refer to the provider notice that was posted by the state on September 18th. Again, the link is there. Same thing for documentation. When you're ready, you'll click the add button. And at that point, then a panel or a module will pop up. And this is where you can either drag and drop files. So if you already have them on your desktop or on your computer, you can drag and drop them into that section. Or you can do the click here and it'll open up a Windows directory, and then you can go find where the file is saved on your system, and then you can upload it that way. It shows you what file formats that the file must be. I will say this has expanded quite a bit since we first started using Qualitrac in 2019. So there are a lot of different options there. Typically what we see are either PDFs or Word documents, but any of those extensions are able to be uploaded. The file name cannot contain special characters, so you just want to make sure that you don't have like an underscore or an and sign or things like that. But it will give you a message if you try to upload something and there's something that it doesn't like, it will tell you. And then once you upload it, if you wanted to change the name of the file, you could, so maybe if it was a scanned document and it's, I know for our company, it puts this really weird long number. You could upload that and then you could change the name of that. So it's not just this big long number. You could, put their name or whatever you want. So that is an option as well. So once you attach it, then under the category box, you'll want to select what type of document is it that you're attaching. Most common or most almost always it'll be clinical. There's some other options under there. So you'll just pick whichever one is appropriate. Again, these are not like, this is not going to make or break the request. We don't look at this and go, oh my goodness, that wasn't marked correctly. This is just how the system was set up. So you would select the category. So if you select clinical, then the next box will pull up that says topic. And then this just further defines what is that information that you're attaching. Is it, an assessment note? Is it a case note? Is it in this case, a medical and treatment history? So it'll just give you some different options that you can select from. Once that's filled in, then you'll click the upload button, which then attaches it to the case. And you can repeat this step as many times as you need. Maybe you have 3 or 4 documents that you're not able to combine into one and you need to upload all of them. You just repeat this step until you get all the documentation uploaded. So once it's attached and all of the steps have been completed, you'll see here under the documentation, the things that were uploaded. And again, under the name, those are blue clickable links. So if you wanted to click on it and just make sure that it's the right information for this request, you can click on that and double check and go, yep, that's what needs to be attached. I'm good to go. And then you're going to hit the green continue button. So we're almost there. We're getting to the finish line. What's going to happen here is Qualitrac is actually going to think for a moment, and then it's going to send you out to what we call the MCG screen. And this is, it used to be called Milliman Care Guidelines. Some of the reviews we do use the MCG criteria, but for eyeglasses and contacts, these do not apply. So when you get to this screen, you're going to see here where it says MCG guideline documentation is not required. And so then you'll just simply click the submit request button and it's going to close this and send you back to the Qualitrac system. And now the last step is your attestation. So this is to certify that all the information is accurate and complete, and that, you've submitted it and you're good to go. So here you're going to enter in your username again in that acknowledgement section, and then you're going to hit the submit button. There's going to be a comments box that pops up. And so if you want to add a comment, you can, you don't have to. Sometimes we'll see providers may say, if you have any questions, please call Jen at, and then the phone number. You don't have to put anything in there, but if you want to put a comment in there, you can put it in there. You have to click this submit button. Otherwise, it will not submit to us. So if you click submit at the attestation, the last page, and you get to this page and you don't hit submit again, it won't get to us. So you have to make sure to hit that second submit button, whether you enter anything in those comments or not. Once you hit that submit button the second time, the page is going to refresh. It'll bring you back to what we call the summary page, and you can then kind of scroll through everything and look at it and just make sure, is everything in here? Did I, make any errors? Now, if you get to this point and you look and go, oh my goodness, I just entered that on the wrong person, you can go to that blue actions button and there is an edit button or there's a delete button. And so if for some reason you realize, oops, this is the wrong person, I need to delete this, you can delete that. If you scroll through and you realize that you put the wrong diagnosis code, you can go back up and hit edit and go down and correct it. So this is kind of your last, okay, is everything correct? This is my double check, making sure everything looks good here. All right, so once you are done with that, then, and you reviewed that, you're good to go. So now we're just gonna look at real quickly how you can view those request statuses and the outcomes. So what's really nice about Qualitrac is it sends email notifications. And so there's 4 main times when you get those email notifications. So when we receive the review request, you will get an email letting you know that the case has been submitted and we have received it. So that's how you know that we got it. If you started a review, but you have not yet submitted it, you will get a daily email saying, hey, it looks like you started this request, but you haven't submitted it yet. And it'll explain if you did this in error and you need to delete it, here's the steps, here's how you delete it. If you need to get this submitted, please use this link and it'll walk you back through exactly what you need to do to get back into the case. So that is one thing. Sometimes, we'll hear from providers where they will say, I didn't realize I didn't submit it. And we can go back in and look and say, well, we can see that you started the request on this date, but it never got submitted to us. So you would have received an email every single day since you started that request saying, hey, don't forget about this case. Don't forget about this case. And the only way to get those emails to stop is to either delete the request or to finish it and get it submitted to us. If additional information is requested, which are the requests for information that we'll talk about in just a second, you will get an email from us. And again, by you, the person that submitted the request will get those emails. So an email will go back to that person and say, hey, we got your request, but we do need some additional information. So please log in and see what it is that we need. And then when an outcome has been rendered, you will get an email saying, hey, your case has been completed. Please log in to see the outcome of your request. There's a few different ways that you can see that request status and the outcome. So you can either find it by clicking on the magnifying glass and either doing a member search or a case search. And so if you're going to do a case search, then what you would do is you would simply enter in the case ID. So that was one thing I forgot to mention, is that when you create that case and submit it, every case has a case ID that is attached to that request. It'll be in the top left-hand corner on your summary page. When you go back and you're looking at it, you'll see that case ID number. You'll also get that case ID number in the email notification that says, we have received your request. It will say, we have received case ID, blah, blah, blah. So there's no PHI that's being emailed. It always just refers to that case ID. So if you're wanting to go in and check the status by that case ID, then you'll say that you're searching by case ID. You'll enter in the case ID number, hit search, and then it'll pull it up down at the bottom there. And then you're able to just, again, click on any of those links and it'll take you into the case. Excuse me. All right, so if you're going to do a member search, then you would be going in, entering the members in for the name. And then what that'll do is it'll drop you into the member hub. And so you'll be back at that initial utilization management panel that we looked at the very beginning. And you'll see the request there. And over on this left-hand side is where you see request has been submitted. If it hasn't, it'll say not submitted. So that's another way to know if you've forgotten to submit it. So on here, under the actions panel on the right-hand side, you can say view request. Now, again, if the case hasn't been started by our team, if the review hasn't been started, that delete option will still be there. So again, if for whatever reason you realized, a day later, oh goodness, I shouldn't have submitted this. As long as we have not started the review yet, you would still have that delete option. Once we start a review, that goes away and you wouldn't be able to do anything with that. You would have to call us and let us know if there was something that was in error on the case. So to be able to see it, then you would just click the view request button there. One of the newer features that Qualitrac has implemented is it's called the Cases tab. And so you'll see here on this screenshot, it's another tab here in between member search, and then this is your case ID search. This Cases tab is actually really helpful and is probably the easiest way. If you've already started a case, you've submitted it, or you're just wanting to go back and kind of maybe look at some other cases that have been submitted. So you would go into that Cases tab, and here you're going to see, again, any cases for your organization that have been entered and what the case status is. And so just the different statuses. So not submitted, we've talked about, you've started the request, but you haven't submitted it yet. Case creation means that it's been submitted, but we have not started the review yet. If it's under review, then you know that the case is currently being worked. Request for information means we have sent it back to you because we need more information. And then if it's complete, then that means it's been completed and an outcome has been rendered. And then if an outcome has been rendered, you'll see under that outcome panel or the outcome column, there would be something there that would tell you if it was approved or not. So I've mentioned request for information a couple times. So if our clinical team starts the review and they determine that they don't have enough information to proceed with the review, maybe something's not meeting criteria based on the information that we have, instead of just outright denying it right then and there, we will typically send a request for information and say, okay, this is the piece we're missing. Do you have this information? And we give you another opportunity to maybe submit more information or whatever it might be. Maybe there is no information, and that's, that's what you would respond back is, this is everything we have. We don't have any more information to send. So what happens is a request for information task will show up in your scheduled task queue. So again, we talked about that very briefly at the very beginning. So from the top navigation bar, it's going to be those 3 lines, or from the landing page, there's that start task button. So either one will get you to the same place. And so if you've gotten an email that says, we received your request, but we need additional information, then you would log in and you'll want to go into your task queue. And here, what you'll see is anything that we have sent back to you that says we need more information. A helpful little tip here is that this little blue speech bubble, if it is colored in blue, then that means there's a note there. And on request for informations, they should always be filled in, because that is where the reviewer has put a note to say, here's what we need. So before you start the task, you can just click on that little blue bubble and see what it is that we need. So then you can, work to gather that information if you have it. And then once you have the information and you're ready to start the task and get that information submitted back to us, you'll click on the blue ellipsis here on the left-hand side, and then you'll have the option to start the task. So when you're in the task queue, or once you start the task, you'll see the due date that you have to respond to the RFI. And so it'll tell you this case, if you don't respond, it's going to technically deny on whatever day. And that day is 3 business days after we send the request for information to you. And so what you'll do is you can scroll all the way down to the bottom of the page, and there'll be a new panel called the correspondence panel. And here is where you'll be able to see the request for information letter. Now, the information on that letter is going to be identical to what is in that blue bubble. So that's why I said you can look at the bubble first before you ever get into the case. So if you've already looked, you already know what you need, then you would want to attach that additional information. So just as we showed initially, you're going to want to scroll down to the documentation panel, click the add button, just like we showed earlier, and attach any new clinical information. Let's say you don't have anything else. You would want to just attach a simple Word document, and you could just type in the Word document, "We don't have any other information. This is all we have. We've sent you everything there is." Because the only way to send that case back to us is to start the RFI task and attach a document to it. Once you've done that, then it will send back to us. So even if there is no other information to send us, just attach a Word document that tells us that. So then the reviewer knows they can continue with the review. So once you've attached that additional information, then now you'll have a button at the bottom that says task queue. And when you click on that, it'll take you back to your scheduled task queue, and you'll see that that task is now gone. And that is your indication that you've completed the task correctly and that it is now back with us so that we can finish the review. The biggest thing I cannot stress enough for requests for informations is please do not start a new review request when we ask for more information. All it does is takes your time, our time, creates a duplicate request, and then it delays the review process because then we have to try to go in and figure out, okay, is this the request that we sent back? Is this a different request? So anytime you get that email that says we need more information, you must go in through the task queue, start the task, and attach the documentation. Don't start a new one. If you don't respond to the RFI by the due date that is shown, the system auto closes the case. So we don't touch it. The system automatically does it. And then it will attach an administrative denial letter under that correspondence panel. So you would get that notification. You would be able to go in and see, and basically the letter just simply says, we asked for more information. We didn't get any information. And now this is a technical denial. So this is not a true denial. This is not something that you would appeal. This just simply means we didn't have enough information to render an outcome. So for up to 30 days, you can reopen that case. So if there was additional information and maybe it just, took you longer than the 3 days to gather the information, you can go back into that member hub and find the case. And then in that action column, you'll have an option here where you'll say reopen. So you'll reopen the case, you'll attach that documentation, and then by attaching that documentation, it'll send back to us. You can't just click the reopen button. If you just click the reopen button and you don't attach any documentation, nothing happens. It just sits there. So you have to make sure that you reopen and attach that documentation. Now, if it's more than 30 days, the reopen option will not be there, and you would need to submit a whole new request and start the process all over again.
Jen,
Yes.
Kimberly has a question she asked, can you tell us how this will work for inmates as they always show inactive?
Katie, I might defer that question to you because I don't know. Would we be reviewing if they are an inmate?
Yes, Lori, I'm gonna have you take that. So this is one of the services, eyeglasses are one of the services that cross over, and DOC is able to order and receive eyeglasses for DOC members that are also Medicaid eligible, but Lori Nelson's going to be the better one to speak on that.
Okay.
So it's kind of odd. I mean, because all the orders and stuff go through the DOC, like Katie was saying. I don't really touch them. I believe, like, I've probably done like 1 or 2, maybe, prior authorization requests for them. Basically, I may authorize it, but then, or if they send it to me and then the DOC is supposed to be ordering it, but I don't even know if I've even done any, maybe 1 or 2, like since I've been here for almost 4 years from the DOC, because they handle all the orders for their glasses.
Okay. So then would we expect to see those if somebody is in DOC? Would those be coming to us or would DOC handle those?
It's possible. Honestly, I probably should know the answer to this, but I can check with the DOC for you guys.
Yeah, we'll take it back
Okay.
and check with DOC, but given
Yeah.
the number that Lori's quoting there on the volume, I'm not as concerned about it, but we'll
Okay.
touch base and get an answer back. It's a great question. Thank you.
Yeah, definitely. Because if that is the case, if they are going to be coming through us, then there's a step at the very beginning that we will have to modify. Because if we do have some areas that we review that does not require somebody to have Medicaid. And so when you search for that person, of course, they're not going to show up. And then an add member button pops up. And so when that add member button pops up, you're able to then enter their information. And then when you go to enter the request, where we have that drop down list, there's only specific ones that are available because only certain areas allow that. So once we get the answer from the state on that, we would just need to go back and make sure that this service is listed so that you guys can select those and enter in your own member. So yeah, that would start from the very beginning. When you search a member and it says member not found, there would be an option to add the member. All right. Good question. Thank you. We're learning this as well. Okay. So to view the outcome or the determination of your request, so again, you can go to the member hub. You can find the case in the utilization management panel. You can click on that ellipsis to view the request and go into the case. Again, the cases tab will also show you that outcome, and then you can just click on the link and then it'll take you right into the case. But if you're going in through the utilization management panel in the member hub and you view the request, once you get in there, you'll scroll down. And so where you had entered a procedure code, that will now be replaced with an outcome panel. And so then you'll see here, it says outcomes. It'll show the code that you selected. I didn't change these screenshots from previous from previous training. So it would show the code that you had submitted, and then it would show you what that review status is and what the review outcome is. By clicking on this dark brown panel, it expands it so that you can see additional information. So on the left-hand side is going to be the requested tab, and it shows you what you requested. And then on the right-hand side is going to be the final recommendation, and that is going to be the final outcome. And so you see here, you know, up here, it shows you approved. It's also showing you approved here. The prior authorization number would also normally be listed right here in this section. But these screenshots were taken out of their test system, and the test system doesn't generate them. So normally there would be a PA number here. And then it'll show you those start and stop dates, how many units were approved, excuse me, and then the letter rationale. So to see that final letter under that correspondence panel that we talked about under RFIs, there will be a determination letter that is attached under there. And so then again, you can click that blue link, it'll pull it up, and it'll if you need to print it and put it in the member's record or whatever, you will have a copy of that, and it'll tell you what the outcome was. So on that determination form, you'll kind of see it set up in two sections. The first section is going to be the requested service. What is it that you requested? And then the second section is going to be, what is the determination? So you'll see here, this is that requested section, and then below it will be the determination. What's the date spans, was it approved? Here's the determination. Here's that letter rationale. If it was denied, then at the bottom of the letter on the very last page, there will be appeal rights. And this is what that appeal rights looks like. And then if you want to appeal it, you would do that through the portal. You can use that link there. Again, it takes you back to our portal homepage. You would log in, you would find the case. And now in the member hub, when you click on that ellipsis, there's going to be the option for a first level appeal. And so then you would be able to click on that. Again, you must attach a letter, stating, and it says up there in that box, state in your detail, your objections, and include any new documentation and information that you want us to look at. I will tell you, if we just simply get a letter that says we think this should be approved and there's no new information to support it, those will typically not get overturned. So there needs to be new information that explains why this request should be approved. That option is there for up to 30 days because providers have 30 days from the date of that determination to request that first level appeal. So you would want to make sure that you go in there and get that within those 30 days. If you have any questions or concerns, please don't hesitate to call our call center. That we are more than happy to help you the first time you get in there. If you're like, oh my gosh, I'm at a loss, I'm not really sure where to go, what to do, they are happy to walk you through those steps. Again, this is the portal webpage that we ask you to bookmark so that it's quick and easy there. So now that it took me an hour to explain all of that, I want to show you real quick for adding in the request. So again, this is, hopefully you guys can see, I just pulled up our portal page. Is that what you guys are seeing? Anybody?
Yes.
Okay, thank you. Sometimes I'm not sure if I'm sharing the specific document or the whole screen. So I was making sure. All right, so here's the portal page. Again, these are the different tabs. So under the education and training, here is that authorized official training that you would want to go to. The recording is here, the slide deck is here. So you'll see there's a lot of them here. After we have this training will be repeated on Thursday. So once these are completed, they will be listed here, just like these ones are, so that you can watch those. So when you go to sign into the portal sign in, I'm not going to click on this one because that'll take me into the live one. I am using the test system. So let me get that one pulled over here. Okay. All right. So here's your sign in page. Oh, I did that wrong. All right. So you're getting signed in. So, and again, this is all dummy data. So there's no PHI in here. So we don't have to worry about that. Here's the landing page. So you can either search here, or you can come up here to the magnifying glass and do a search up here. So I want to get started. So if I click search here, it defaults you to this case ID. So if you wanted to do a member search, you start here. And so for speed, I pulled some information beforehand so I could make sure that I got everything in here. All right. So then you put in, I'm searching by the member ID and the date of birth, it matched. And so this is where it pulled it up. So let's say we, talked about that. I don't know if this will be, So this is if the DOC ones do come through us, this is what you would see, is that it would say member not found, try searching again, or you can add a member. So that would be the step that you would want to do for those requests. But for everybody else, you want to make sure that they pull up in the system. So this is the person. So I click on them. It pulls it up here. As you can see, we use these test people for a lot of different situations. You would only be able to see any of those that are related to your specific organization. So I want to add a new request. So I'm going to click the add button. And now we're just going to get into those panels. So this defaulted, the review type is Health Resource Division. This defaulted. And now this time I'll pick contact lenses. And then this is going to be a prospective because it's in the future. Just real quickly on here, concurrent usually means like they're already like in the middle of services. So that doesn't necessarily apply here. But prospective is most of the time what you're going to be putting in is because they have not received it yet. So you're asking for it in advance. Now I'm adding that new request. This is where it takes the system a moment to kind of refresh and think. Here's that case ID. So it's already generated it for us. So dates of service, I'm just going to click on the calendar and then click again. So it automatically pulls in today's date. And now I'm going to go a month out because we're not really quite sure, when the person is going to be getting the items. So we're going to do that. Here's that member not eligible. Because this is the test system and it's all dummy data, this always pulls up in our test system. So this is the eligibility comment box. And so you can just put a note in here. So you could even just say Medicaid eligible. Here's those other things. And this is all pulled from that eligibility file. If it's an EPSTED request, here is where you would mark EPSTED for that. Personal representative, we don't have to do it. So we skip it. Providers is required. So it's got the red asterisk. So I'm going to add a provider. So this is a new feature I actually just found, is it used to take you to a whole new page and now it just expands it here. So every time I do these, I find new little treasures. Okay, so I'm going to enter in the NPI number here and just hit enter, or you can click the search button. And so it pulled the provider up. So again, if it pulls up multiple and you want to make sure you have the right one, you can click on the link here. And what it does is it opens up another tab and it'll show you here if this is still active or not. Now, again, test system, none of that information pulls in here. So I'm going to go ahead and add this. So I click the green button. It now added it to the case. And now I'm either going to add, so this is who is billing for it. So this is the organization. The ordering provider is going to be the specific one. And so then when you enter it, so then again, you can just click the green button, add them to the case. And now the add button is gone, but here is where if you needed to delete it, you could, and then that add button will come back. Provider organization visibility, again, in the test system, I'm not associated with an organization, so I don't have an option here to pick, but normally there would just be a drop-down box right there. Diagnosis, I've got the add button. I am going to put in, and again, I have no idea. I was just doing some Google searches and pulling things up. So this is the one I want. So I'm going to select that radio button. If I want to add another, I will, but I'm not. That's the only one I need here. So I'm going to go ahead and do that one. Oh, and then of course I forgot to put the procedure code. So I have no idea. Oh, hey, I remembered. Okay, so I know that's not a contact one, and we put this under contacts, but it's the code that I remember from testing things. So again, you put in the code, you get an option, you select the radio button, and now here's the modifier drop down. So if you need to add a modifier, you can add the modifier. If for some reason you get in there and the modifier you need is not listed, just call our call center. We have run into that a couple times for whatever reason. The correct modifier maybe isn't showing up, and we just have to work with Telligent and have them add it. So, and then here, if you need to change the number of units, you can. We don't need the rest of this, so you don't have to fill anything else out. The main thing is just the units if you need more than one. Same as the diagnosis, we're going to go ahead and submit this. So we've got one each there. We've got the garbage can if we need to trash it and start over. And then the documentation. So I'm going to add the documentation. And then I can either drag and drop or I can click here. So I am going to just do a drag and drop because I've got it over on my other screen. So I dropped it there. And so it automatically pulled in the name. And so now I have to pick the category. And so here I'm just going to do a clinical. So you can see here, if this were an appeal request, then you would be able to label it as such. But I'm doing a clinical. Now the topic box opened, and I'm going to say this is the assessment and the plan. And then I'm uploading this. It now shows that it's attached here. And so then if I click this link, it pulls up, I can open up my document, which it's opening on my other screen. And then I can look at it and go, yep, this is the correct document that I need attached, and I'm good to go. So I hit the continue button. This is where it's going to kick us out to MCG. It tells me that documentation is not required, so I'm just going to submit the request. Don't click on anything here. There is kind of a pause, so once you click that, just wait. It'll kick you back in here. And so now I'm putting in my username, and I'm going to submit. Here's that box that popped up. I don't have any comments that I need to leave, and I'm going to hit submit. And so now it's doing its whole refresh. It's getting it submitted to us. And now here's that summary page. So here's the blue action. So if I realize this was the wrong person, I can delete it. Maybe I find an error, I can edit it. So without clicking that blue action button, nothing is editable once you get down here, except documentation. If you realize you needed to add another documentation, you could. So you'll see here, here's that case ID again. You can check your dates of service. You scroll down, you go, and now that procedure panel has turned into an outcome panel. So if I click that, it minimizes. If I click it, it expands. And here's the correspondence panel, which we've not done anything with the case yet, so there would be no letters attached. So then that is the end. So you're done. You can either go back out to the task queue. If you wanted to print a summary of this, you could, but that's the one thing, is there really isn't like a done button, but you know at this step, it has been submitted. And then I just received an email. And so this is the email that I just got. It said, thank you for submitting your request. This is to notify you that it has been received and we are in the process of reviewing it. Here's your case ID. And you're good to go. So I know that this has been submitted, and now I wait for the review to be completed. So that goes to show that it's much, much quicker to enter the request than it is to walk through everything. At this point, if you want to go back to the task queue, you can, either down here or up here in this, what we call the little breadcrumb trail. This would take you back out to that task queue. So if you had an RFI, this is where you would go. If you want to go back and look at this person's member hub, you can click here and it'll take you back into their member hub. So you can see here it says request has been submitted. These ones, request is complete. It shows the outcomes. Request is in progress. So we've got lots of different things happening here. So this is what your task queue looks like. Now, of course, I'm in the test system, so there is nothing in there. But you would see there would be something here if there was a request for information, and then you would be able to your ellipsis and your blue bubble would be over here on the left-hand side, and you'd be able to click on those and see those. Here's that cases tab. So you can come in here and you can see, so I've got 3 of them that are in case creation. You can see when they were received, who it's for, their case IDs. So this has been a really nice addition. And then on the case search here, so one thing I just wanted to touch on really quick is, so the case ID, of course, is what I just showed you that gets generated on the case ID. Search by authorization ID. Maybe, you know, you have the PA number and for whatever reason, you need to go back in and look at something on the case. You can do search by authorization number and then put that prior auth number that we gave you on the outcome letter, and you can search that way. Search by claim number we don't use, so you won't be able to search by claim number. The other thing is search by request ID. And again, this isn't something that you would necessarily use, but I'll just show you really quick on this one. So there is a difference between case ID and request ID. So there's 2 numbers here. We have some requests where there might be an initial request and then say a continued stay review. So the case ID stays the same, but the request ID changes. So for some people, if they've got 3 requests attached to one case ID, then it's easier for us to find the case by the request ID versus the case ID. But just so you know, if you're in there and you're looking at that. All right. So that is submitting a request. Are there any questions that I can answer for you at this point? Please feel free to unmute if you do, or pop it in the chat, whatever is easiest. All right. Well, I thank you guys for your time today. And again, if you do have any questions once you get in there and get started, or if you're having troubles getting set up with the authorized official and doing all that, that is one other thing I will just show you really quickly because I did not show that. So when you get in here and after you review the authorized official training, you can either come here and click on this portal registration link right there, or in the document library, you can get there here as well. So there's 2 different ways that you can get there. All right. Well, thank you guys so very much for joining us today. If you do ever have any questions, don't hesitate to give us a call. And we look forward to working with you guys. Have a great day.